Um, Welcome, everyone. Hi. Um, Thank you all for joining us today for the FCI webinar on getting published with Professor Jack Li. I'll shortly be handing you over to Sarah Slight, who will be introducing today's session. Before I do, I'd like to go through a few housekeeping rules with you. So if I could bring your attention to the slide that's up on screen. Could I ask you all to remain on mute during the presentation? We do have a Q&A section at the end, so please feel free to unmute then and ask any questions you may have. Just to let you know as well that today's webinar is being recorded and it will be available on the faculty website and YouTube channel. Lastly, we do have an evaluation form. So if you do have a few moments to complete it, that would be great. It just provides us with a bit of feedback on today's webinar and helps us improve our webinar series going forward. Thank you. I'll now hand you over to Sarah.
Thank you very much, Shalene. So it gives me great pleasure to welcome Professor Jack Li, who is joining us from Boston today. Jack is Editor-in-Chief for the BMJ Health Care Informatics Journal, which is one of more than 70 specialist journals by the BMJ. Jack is currently Dean and Distinguished Professor at the College of Medical Science and Technology at Taipei Medical University, and he works on lots of national and international projects and has a specific interest in artificial intelligence and the use of it in medicine and medical informatics. He's currently serving, or he has served as president of the Asian Pacific Association for Medical Informatics, and he's president-elect of the International Medical Informatics Association. So Jack is going to talk today about getting published and giving us some advice and top tips, which will be great. So I'd like to hand over to Jack now. And thank you, Jack. Really looking forward to your presentation.
Thank you, Sarah. Good afternoon. It's morning to me, but I think most of you are in the afternoon. It's a great pleasure and honor to talk to you, the Faculty of Clinical Informatics, about how to get published in BMJ FCI. And my name is Jack Li, just as Sarah introduced. So this is today's outline. I'm going to use about 30-40 minutes to get through all the slides, and then we can have a Q&A in the end for like 10 to 15 minutes. So this is me. I'm also a dermatologist, but I actually spend like 80% of my time dealing with information technology. I've been a chief information officer in several of our teaching hospitals, also our university. I've been VP on informatics with the university or hospital. So although I still see some patients twice a week, I've been chief editor-in-chief for several different journals, and they're doing relatively well. I'm also the Australian and American Medical Informatics Association. I mean, actually, it's a fellow of the American College of Medical Informatics, and also the Australian College of Health Informatics and the International Academy of Health Information Science. These are our deputy editors of the journal. As you can see, we have relatively more deputy editors than other journals, and as you can see, about half of them came from the United Kingdom. And besides that, we have people all around the world, you know, from the United States, from India, Germany, Canada, Australia, China, and so on and so forth. These are the editorial board members. I mean, in addition to the deputy the editors, these are the board members representing several different countries. The way we use our board members is that if we have a quick review, if we have some paper that we cannot find a review for a prolonged period of time, then we have our board members to do a quick review. We also have a quite distinguished advisory board members. We have, I'm not going to go through all of this, but some of you apparently probably already know, like Dr. David Bates in the United States that I'm working with right now. Dr. Charles Saffron, also from Harvard Medical University. He's a close friend, and actually I just had lunch with him yesterday. And Enrico Correa from Australia, Maren Bo from the United States, Sabine Coach from Sweden, and Tesholu. He's our textbook guru from the United States. And besides all that, the paper editor, we did recently hire a social media editor. So when your paper are published in our journal, make sure that it will be promoted as much as we can through the social media. So we have presence on all the major social media like Facebook, Twitter, Instagram, LinkedIn, and so on and so forth. So as you can see, the aim and scope of BMJ FCI is actually 100% consistent with, I see a few, one sentence on the bottom of the screen before we start, right? It's provide safe and effective health and care through information, something. I mean, that's very consistent with the journal. So actually, whatever you do under that, aim or goal is publishable. Okay, will be publishable in our journal. So basically, informatics to support informatics, meaning methodology and way of IT, right? To improve healthcare, public health, implementation of health system, learning health systems, and even national policy. So a broad range of healthcare impact that can be facilitated by informatics. And especially, compared to other journals, I've been asked quite often, there are like at least 20, 30, 40 informatics journals out there. What is the difference? What makes BMJ stands out? I think the difference that we're emphasizing is we want to bring together the academic and practitioners community, meaning we want to hear more about implementation and what is the practical issues and problems and solutions, in a sense, what's, happening in the trenches, right? So the everyday healthcare issues and how informatics interact with these issues. So, so that kind of reflects on our types of papers. So original research is your regular paper or research paper. Review, you all know about review. Usually review are invited unless it's a systematic review. Okay, and protocols. We're going to explain all of this one by one. So we have the shorter papers from editorial, letter, communication, short reports. And the middle length education report and implementer report and protocol to the longer ones like research, original research and review. Actually, for practical implementation issues, we quite welcome implementer report. Okay, I'll get to that later. And also short report. We actually prefer shorter paper than longer paper, as you know that the attention span of our audience over the world are getting shorter. So all the detail can be found in the author guideline. So before you submit, please check out the author guideline on the BMJ HCI website. So for original paper, one example is this from Johanna Westbrook from Australia. Changes in medication administration error rates associated with the introduction of electronic medication system in hospitals, a multi-site control before and after study. So as you can see, a control study, a randomized control trial, with an intervention, which is in this case is an electronic medication system, and how does that impact the medication administration error rate? Okay, there are of course many different type of medication error. One major error is the administration error. Okay, so when you administer drugs to the patient, and they also classify the outcome as from it's significant to serious, and then report the outcome. So it's an interesting question, and it's a good design with the experiment. So that fits the original research category. Review, in this example, a systematic review. This paper looks at the so-called, they call it DSMES. It's actually diabetes self-management education and support apps. So they review many different apps and many different papers that review the apps. So it's a kind of a meta-analysis. I think they eventually retain about 5 studies, and then look at the effects of these apps on the compliance of the medication adherence for diabetes patients. So as you can imagine, we welcome warmly systematic reviews on topics that hasn't been done before, or on topics that haven't been done in the last 3 to 5 years. If it's an ongoing, updating, dynamic kind of topic, then if you see a topic that's not been done for 3 to 5 years, you can probably do another one if there are enough literature popping up. Protocols usually is before you do the study, so you publish a protocol that you're gonna do. But this happens when you have a very detailed, well-structured, well-designed protocol. So this is not like we don't like get a lot of these submissions though. So implementers report is probably the type of report that we can see more from people in or people affiliated with FCI. It's a specific type of short report, so we actually allow more words than the real short report. So you could go as far as 1,200 words with several tables and figures. So as the name implies, it's about implementation. So the example I'm showing here, it's actually kind of a fun example. Is the rapid implementation of Microsoft Teams, which we're using right now, in response to COVID-19, right? One acute healthcare organization's experience. So this is from the Royal Free London NHS Foundation Trust, and they use it in the hospital, Microsoft Teams, for all types of interactions, including meetings. So they started in March, and there are only like 7 users. And in June, there are already 1,500 users, and they've accumulated like thousands of meetings. And the virtual meetings has been like exceeding 1,000 in a week. Okay, so that means, and there, when you look at it, it looks like, well, this is just some implementation experience, right? But for the implementers report or implementer report, nothing is really too trivial. I mean, anything that you do, that you face in your everyday practice, that will involve patients and caregiver, healthcare system, like in this case, it's it's a package, Microsoft Teams. It's a outside software and you just implement in one of the workflow, which is meetings and interactions. So it's not very complicated, and it doesn't take a long time to write a paper like this. But again, we like papers like this. You know, we like to know what's really happening in the front line. You know, so you don't have to. It's not like every paper has to be a 5-year randomized controlled trial study. So that's kind of what makes BMJ FCI a little different from other journals. And also short report. A short report is actually just like in this case, let me just use this example. It's comparison and impact of COVID-19 for patients with cancer, okay? A survival analysis of fatality rate controlling for age, sex, and cancer type. So it give you, it's a timely topic, of course. You know, people are interested in all kinds of comorbidity with COVID-19 patients, cancer being one of the most interesting comorbidities, and how does that impact on survival and the fatality rate after controlling all the variables. Well, strictly speaking, this is not an informatics paper. This is more like medical statistics. So as you can see, sometimes we also accept papers like this if the analysis are complex enough, or you have to use a little more informatics tool to do the analysis. I mean, there's not a clear line. Of course, anybody who process any data will use computers. Not all the use of computers can be qualified as informatics, right? But if you use complex tools, even including statistics tools, information management tools, like Microsoft Teams, it's not really something that you implement. You just rent it from Microsoft or buy it from Microsoft and use them. So you don't have to necessarily develop your own model, write your own software, in order to write a paper like this, right? So this is just what I'm trying to get to, the message to you. Okay, so one type of paper is called communication. It's actually a little bit like a short paper, letter to the editor. There's no clear distinction between a communication and a letter to the editor. So in this case, for example, this is submitted by our friend from MIT, Dr. Leo Anthony Selly. So he has a point of view about how a hospital or a healthcare organization should establish a dedicated clinical artificial intelligence department. Meaning, so as you can see on the right-hand side, if you use the current infrastructure with IT department, research department, hospital, clinical data, and commercial models, you end up with a quite inefficient communication network, or a quite complicated workflow that's quite difficult, for developing anything new, with AI. But if you have a medical AI department, then everything gets easier. So as the title implies, they hypothesize, or they believe that a clinical AI department is actually a prerequisite for success. So it's a short paper about a point of view. So this can be like viewpoint, perspective, things like this. And it happens that this paper, when published, gets to be one of the most popular, soon became the most popular paper on the social network. So a lot of people were, and they got media attention. So they received several interviews from the mass media after the publication. Education report, that's a new type of paper type that we're introducing. So because training and education is, of course, always a key part in health and care informatics. However, it's a little harder to evaluate education, and you know, we always, as an educator myself in this field, I feel like I always need a novel approach to curriculum design. I've taught a course of medical informatics for the School of Medicine for 20 years, and I have never had the same curriculum, you know, any 2 years. I have to revise it every year for 20 years. So, so education it could be a very interesting topic in our field. And okay, so besides paper type, these are the submissions by corresponding author country. So as you can see, UK and US is always the top 1 and 2 for submission, and gradually we get India, we get more from India, and you know, some from Africa like Ethiopia, and we still get quite popular submission from Australia, New Zealand, Switzerland, Canada, so on and so forth. These are the acceptance. So the previous one is submission, and the next one is about acceptance. They're not necessarily consistent, but the first 1 and 2 are the same. Still UK and US. So, so as you can imagine, we are very UK, you know, not like pro-UK, but I mean, UK is our major customer in terms of submissions. And then Australia, it was number 3 in terms of acceptance. And we also Ethiopia, Canada, New Zealand, Japan, and so on. So there's some tips about how to, what are the good topics. For example, if you have a new IT development in your department or in your organization, be it a revise, a revamping of the system, or introducing a totally new system, be it a major system like a CPOE, like EHR, or a minor system like a reminder, or a like a reporting system, an adverse event reporting system, or something like that. It doesn't have to be big systems. Smaller system, and you have some numbers that you can review it, that you can do a preliminary evaluation, things like that. I mean, that would be an interesting topic to the journal. And of course, hospital systems, or you know, anything that you do for your patients or consumers, apps, reminders, systems. I mean, these are all publishable. Okay, so we rely on one. I mean, there are many parameters to know what an impact of your paper, published paper, will be. One of the index that we're looking at is called Artmetrics. Not everyone is familiar with Artmetrics. It's something that track the influence of your research as soon as it's published, and it uses a plethora of measurement to see the impact. So anything that's I mean, if your paper is on news, it's blogged, it's tweeted, it's on Facebook, it's referenced in Wikipedia, mentioned in Google post, or on Reddit, you know, or on YouTube or Mendeley site. I mean, there are many. I don't want to go through all that, but they do look at many different way of circulating or promoting the papers. So if you get more exposure, so it's quite consistent with the impact of the paper to the general public and also to the academic as well. Okay, the other measurement that probably some of you are more familiar with were called the impact factor from journal citation research. Impact factor is only looking at the citation within 2 years after the publication of after the publishing of the paper. Within 2 years, how many other journals that's within JCR actually cited that paper? So it's quite limited. It's a very limited index. Unlike our metrics, they actually look at multiple sources. One of the highest metrics paper that we've got is on my left lower corner, performance of national COVID-19 symptom checkers, a comparative case simulation study. This one is actually in the media with BBC, and it's kind of affecting, internationally how people and government use their COVID-19 symptom checkers. One finding is that the UK symptom checker is not very accurate, and tend to tell patients to stay at home no matter what you got. So if you're interested, you can take a look at that paper. And we just had a journal club about the paper a few days ago, where Daniel, who is the author of the paper, came to do a presentation. He was in Scotland, and when he was doing the presentation, he told us that he just contracted COVID-19. Well, that's too bad. So wish him a speedy recovery. Okay, so we also do commission papers, like the one that I mentioned about medication administration error rate from Johanna Westbrook. That's a commission paper. Johanna is a very well-known researcher in patient safety, and also the one that's about the clinical department, the AI department from MIT, from Leo at MIT, also a very famous member of the CCL, the Computer Science and AI Lab in MIT. Yeah, so these are. Okay, so so 136, this is the out metrics for that specific paper. It's actually a short paper communication. So once it's got picked up by the media, like Eureka Alert, it's actually a media. It's kind of academic media. As you can see now, many journals are publishing news. Okay, if you go to Nature's website, you will see that the first 2 pages are mostly news. But news are also citable. It's an interesting trend that we're seeing now. Major journals will actually hire full-time people or hire journalists to write news for them based on the papers they're publishing. And that news itself is also citable. So when you cite the news also cite the papers. So that would turn into a citation circle and increase the impact factor of the journal anyway. Okay, so these are like media exposure for that one specific paper we're talking about, the Clinical Artificial Intelligence Department, a prerequisite for success. So as you can see, it's published, it's mentioned and reviewed in many other papers, journal, newspaper, still a kind of paper. These are just recently published, so the metric is still very low because we just published like last week. So we have the commission paper from Tasholi, we have from Atul Butte. They're both very famous, like like Ted is our textbook guru, and also I think everybody knows him. Atul, a young and very promising scholar in biomedical and bioinformatics. Lucia is he's the new dean, a new chair of the Department of Biomedical Informatics, University of Utah. Okay, so this is the paper that I mentioned from Daniel, that he and his colleagues compare I think six or eight national COVID-19 symptom checkers, and they feed them simulation cases to see how the symptom checker respond to these cases. One of the things that he found out is that even in one of their simulation cases, the patient developed sepsis, and the symptom checkers still recommend the patient to stay home. So that's not a good recommendation. It's a bad recommendation for some of the symptom checkers. So yeah, so it got caught up with the news, like medical news, like Medscape, and these are the UK news, and the Guardian, Medical Press. And that actually brought the paper to 419 in our metrics, which is like exceedingly high score. Usually a journal publish papers for a whole year, and maybe one or two papers gets to 300, but this one gets to 400, so it's actually a pretty high score for any paper. So as I said, we also do a lot of social media. So and you're welcome to follow our social media because we would publish, we will mention interesting papers, reviews. We also cite we also give you, exposure from in the other media, or we also publish, we also we also post the journal club time and place, and it's free. So as long as you register, all the journal clubs are free, and we're doing it every month or every 2 months for the BMJ Health Care Informatics. So if you search for BMJ space HCI or BMJ Health Care Informatics on Twitter, on Facebook, or LinkedIn, you'll be able to get to our social media outlet. Also, this is the journal club that I just mentioned. So the last one was in June 15th about the performance of the COVID-19 symptom checker, and then the next one are in scheduling. We will soon release the schedule once it's available. Okay, so that's all of my report. If there's any question, let's go into the question and answer. Thank you for listening.
That's wonderful, Jack. Thank you so much. What a great presentation. So if anybody would like to ask Jack a question, now is the time. You can either put your hand up or post it on the chat. I see one question's come in from Rahim. Rahim, would you like to ask your question?
Yeah, my name's Aisha Rahim. Thank you very much for that presentation. I found it really, really interesting, very practical as well. The question I had, Jack, was whether there are any other top tips that you can give us if we're hoping to submit an article, an original article. Is there anything that we should do or shouldn't do to make the reviewers' jobs easier?
Okay. Well, thank you for the question. It's a good question. I mean, there are, of course, the general things that you should be careful about, like the writing, the quality of the language. But I think for me, it's most important that you have a good title and a good abstract. That's probably going to determine the 50% of the success chance, right? And then have good figures and good tables. If you have all these, I think you have a 70, 80% chance of getting accepted. And all the rest are things that's common sense, right? Have a reasonable, a clear results, a clear method, a reasonable discussion, and a clear description of the limitation. Do not over extrapolate, things like that. That you can find. I actually today I did not say a lot of the generic, paper submission principles which you can find anywhere online. It's quite easy to find. Like you have to have a readable English. Don't be too verbose. Don't use too many this and that. I mean, there are just many suggestions. But anyway, as I said, the attention span of our audience around the world are getting shorter and shorter. So people are quite unwilling to read very long and very verbose long papers, right? They want you to get to the point and, catch their eyes. I don't want to say this, but it's a little bit like doing the news, right? So you need to have a title that actually catch people's eyes and want to take a further look, because there are just so many materials competing for your eyeballs. So as we all read papers, we read their table of content first, and then we pick one or two papers that we have time that we'll read. If we have longer time, maybe 3 papers. But no one or very few people will actually go through every paper, a journal published in an issue. So I think that's something that's to be careful about, So, yeah.
Thank you very much.
No problem.
Thank you, Aisha, for your question. That was a great question. Any other questions for Jack? Okay, so while we wait for any other questions to come in, Jack, can I ask roughly what is the time to publication from submission? And I appreciate you can't. It's a question that lots of people ask, and different journals run at different paces.
Exactly. We have that's a fair question, and of course, as the editor-in-chief, it's one of my most important job is to keep the response time in a reasonable time frame. And our internal control, I'll just tell you, our internal control is that if a handling editor, deputy editor, if a handling deputy editor is not cannot find good number of reviewers in 2 weeks, you will get an alert. And so we are trying to, I think the current number is about 35 days to the first response, okay? But there are two types of, many two types of first response. The first type is reject, right? So, and if it's a easy, clear reject, you probably get it in 3 to 5 days. And the other is revision, okay, and rarely acceptance. Usually the first review did not give you acceptance. You get a revision, whether it's a minor or a major revision, right? So we are striving to get you the first response within 30 days. The current number is 35. So we're relatively responsive to other journals. Some journals are inconsistent. You submit a paper, sometimes you get a response in 4 weeks, sometimes you don't get anything after 8 weeks. In our case, we now have a mechanism that would actually guarantee, or not guarantee, but partially guarantee that the response will be within 30 days. Yeah.
Wonderful, Jack. Thank you. Another kind of more practical question: how often does the journal publish their articles? So is it quarterly, monthly?
Oh, okay. It's an online open access journal, so we don't actually, we just publish whatever that came through the system. And now, because a paper-based journal has the concept of an issue, right? So you accumulate 14 papers, 12 papers, you publish them in a book and call them an issue. In our case, the issue are virtual. So for every 10 papers we publish, we will call that an issue, and we will pick one or two, and we call it editor's choice, and we will use the BMJ promotion machine in our the media, social media editor to promote these papers.
Great, wonderful. Okay, don't see any other questions. Let me ask you one, Jack. I mean, it's my first time seeing the social media editor, which I thought was a fantastic idea. I appreciate they're probably relatively new to post, but I'm assuming their role will be in promoting on Twitter and all the social media channels, or do they have more of an active role in portraying the message from a particular article and how to tailor that message?
Yes, so it's both. For example, the comparison of national symptom checkers, blah blah blah, a comparative study. But in the social media, you will see something like, oh, the symptom checker make us miss the important COVID-19 cases. Or, I mean, it will become more news-like, right, when they're trying to promote the paper. But the paper itself, although I say you want to have the audience eyeball, but we can now write the paper like the news. So that's where the social media editor comes in. They will cite your paper, they quote your paper, but also give it a little bit more, attractive kind of a short paragraph or abstract to it.
Wonderful, Jack. Thank you. And we've got a question from Lindsay, and her question is, do you have a sense, Jack, of what are the most popular types of articles amongst your readers?
Well, of course, the things that people care about, like, of course, COVID-19. Well, but we've already have a lot of COVID-19 papers, so you need to find a fresh angle, right? Because reporting on comorbidity, different therapeutic options. Now it's more about vaccines, right? So if there's some informatics intervention that can change the vaccination behavior or policy or whatever quality, that would be interesting, right? That would be like everybody's attention is now focusing on that, the relationship between the vaccination and a different variation of COVID-19, and how does that change the national policies? And there are also the low and middle income country that has a problem of obtaining the vaccine. Is there any solution to that problem, or any light that informatics can help? I don't know, but so the most popular papers are usually related to the issue that most people are concerning about, right? And again, I would like to see, for example, every hospital is now quite busy with COVID-19 patients, but still life goes on. You still have to do your routine daily job, right? Does this actually impact the IT system, or does that impact the interaction between our medical staff and the IT system, or how does the IT system adapt to this new normal? These are interesting problems, and we're facing it every day. It's not like you have to invent something, right? It's something that's already happening, and we're just too busy handling it most of the time, and don't have time to write it up. Right? Yeah.
That's wonderful, Jack. Thank you so much. I mean, it's great to have so many options at this journal. There's different types of articles and really accommodating a whole wide range of topics as well that people are interested in. So I don't see any more questions, Jack. So maybe I should close and thank you very much for your time. And I think it's wonderful to get an insight into the work that you're doing with the journal and on all the promotional channels that you're using. So thank you again. I don't know how I express my thanks, only to applaud you, but on a video or on a teleconference call, it's always a bit tricky. But thank you, Jack.
Hey, thank you, Sarah, and thank you all for participation. Thank you. I look forward to see your manuscript submitted to our journal.
Okay. Thank you, Jack.
All right. Bye-bye. Thank you.